Coronavirus cases can get complicated because it means sorting through piles of data.
For today's In It Together segment, KITV4's Maleko McDonnell talks to our tech expert, Ryan Ozawa, about taking data collection into his own hands to get that information out to the public.
Ryan, great to see you. You've been the map master tracking these coronavirus cases in Hawaii. Why do you think it's important to see the information this way?
Well, I'm a tech guy, but I work in real estate, and what we know in our industry is location, location, location. Sure, you've got tables and charts and graphs and numbers, but nothing really gets a point across sometimes, like seeing a map pin close to where you live or where you work or where your kids go to school. It's one of the best ways to visualize information. That's definitely something we know at my company.
When you look at the data and the recent spike in coronavirus cases, have you noticed any patterns or any anomalies that you can't explain?
Well, I'm not an epidemiologist, not a doctor, a nurse, have no business in the medical field, just a data geek. I think that when you look at the maps, you definitely look for concentrations that are out of proportion to population density in the area. I think a lot of times you're going to see concentrations around military bases. I think that that's not uncommon, and there's always a lot of concern about the military's role or the military reporting. My understanding is, though, that the military is reporting to the state and that those numbers should be included in the counts that the Department of Health puts out.
Do you think we're missing any data, or is there something that the Department of Health could be providing that would make it more useful?
Missing data. I mean, how much time do you have? Clearly, the Department of Health is putting out as much information as it feels comfortable. Dr. Park, Dr. Anderson are certainly concerned about privacy and health laws and impacting businesses, but I think that it's clear they have more information than they're making available, and I think that's pressure that the public is right to put on them to disclose. A lot of businesses, I think, are correct in disclosing when there's a case at their facility, so we can make decisions based on who we know who goes there. If we went there, know someone who works there, but the Department of Health has the full list of these locations, and I don't think that it would be as dangerous as they think to make that full list available. I'm tracking them as best as I can, but that's only based on whether the news media covers it. And, you know, the zip code maps where all of this started for me are good. They give you a range. I think when you were dealing with 1 or 2, 3 cases a day, it made sense to not be specific. But now we need to be specific. Now we need to know exactly how many cases per zip code, which is an enormous area. And just so that we can see from day to day, is there growth or is there reduction in the cases? Because when you're jumping from, this could be anywhere from 30 to 60 cases, that's not really useful.
Ryan Ozawa from Hawaii Information Service and our technology expert here at KITV4. Thanks for talking with us today for our In It Together series. For KITV4, I'm Maleko McDonnell.
Thank you.